Good morning, everyone. We're just going to wait for another couple minutes and see if we can get a couple more people on. All right. Good morning, everyone. Happy Friday. We made it through the week. Yay. My name is Jackie Connery. I'm the Community Health Nurse Supervisor here at Two Rivers Public Health Department. So thank you guys for joining us for our clinical update today. So for our first slide, we have, it's just our front page. And I'm just so proud of this page. I love vintage posters, and I love these ones that I found yesterday to do with public health. So just love the old-timey, just how simple they are, and they just amuse me. So for your pleasure of viewing. All right, let's get down to the nitty-gritty of things. So our first slides are the same as always. This is who we are, Two Rivers. This is our 7 counties. What we do, our mission and our vision. And then this is just a reminder that we are Region 7. So as you can see, where Nebraska is, we're Region 7. And into the nitty gritty. So COVID by the numbers. So total US confirmed cases, 79,853,683. I'm so proud of myself that I got that number right. Yay. Say 7-day average per 100,000 people is 53.2. And total US deaths were at 976,229. So all those numbers have increased, but not quite as much as they were. Total Region 7 confirmed, 3,423,177. And total Region 7 deaths, 42,044. Nebraska total confirmed, we're at 477,830. And we're at 4,144 deaths. So those both did increase just a little bit, kind of the same as, the overall numbers, but we're starting to slow down. So that's, a little bit better than what we were. So Kansas, we're total confirmed at 770,775. It's a lot of sevens. And deaths, they're at 8,292. Missouri is leading us all. Total confirmed 1,416,109, and total deaths 20,163. In Iowa, total confirmed 758,463 with 9,445 deaths. So if you look at the map, you're going to see our 7-day case per 100,000, sorry. So Nebraska did increase a little bit from last week, but we're still pretty low to what we have been. And all the other states around us have decreased. So very good to see, very refreshing. All right. So our Two Rivers Public Health Department dashboard. So this you can find on our Two Rivers website. We update this weekly. So this is from March 30th. As you can see on the risk dial, we are in the green and low, yay, second week in a row. And pretty much all of these different graphs, you can see that our numbers are reducing and they're staying down. So that's really good to see. The district daily case rate per 100,000, we're at 2.5. And when I was talking with Katie Mulligan this morning, she said that's the lowest she's seen it. So that's awesome. Cumulative deaths as of March 30th is 205. Our next is the Two Rivers Public Health Department hospital data. This is about the same as what the other pages. Pretty much what you can see is it's went down. So percent of COVID beds, as you can see, that's dropping. So that's good to see. Our EEI on the right side. So we had 32 total ICU beds, and this is from yesterday. 7 total ICU beds were available, 1 total ICU COVID patients. And then we have 39 total vents, and 5 of those vents are in use, and 1 was COVID. So, and once again, you can find these, the hospital data on our website on Two Rivers. Okay, so this is our COVID data tracker weekly review. So this is from cdc.gov. This week, their weekly review is signals in sewage. So this is actually quite interesting. So they've been watching wastewater, and so they can actually detect SARS-CoV-2 viral RNA levels. And what they are seeing is they usually see an increase 4 to 6 days before clinical cases increase. So it kind of gives us an idea of when our areas are going to increase. So there are some different links that you can click on here to get some more information on how they are using wastewater to surveillance SARS-CoV and the levels that are in our communities. So I thought that was very interesting, a little unusual, but very interesting. And, you know, anything that can help us get the upper hand on COVID. Let's talk COVID vaccines. So as any healthcare provider will tell you, communicating effectively about health issues requires tailoring to the individuals, tailoring to an audience of one, which is exactly what Let's Talk COVID Vaccines does. It's developed by the Institute for Vaccine Safety, Johns Hopkins Bloomberg School of Public Health and partners. The unique personalized design, drawing on health communication best practices, tailors the visitor's online experience to the individual's vaccine concerns, goals, and demographics, blending a mix of personal stories with science-based animations. Let's Talk COVID Vaccines delivers concise content to provide the right message to the right person in the right way. So I did hyperlink this, so you guys can click on the Let's Talk COVID Vaccines. And then this is just a screenshot of the first page. So you go onto there, you select an option, it asks you some questions, and then it kind of personalizes the information for you about COVID. So it really does individualize it and go, more direct to what that person is looking for. So it is a very good website. I did it the other day, learned a couple things. So I call that a win. Next slide, we have resources. So this is just a couple different resources that I've hyperlinked for you guys that you guys can go into and learn about. First one's updated messaging plus the toolkit, the second booster doses. Second is register today, communicating through COVID-19 and beyond. And the last one is rising stress and burnout in public health, results of a national survey of the public health force. So when we send out the slides, you guys will be able to, they're hyperlinked and you can just click on those. All right, so now we move on to our flu view. So our updated map, we went from low activity to minimal activity from last week to this week. So the key points from flu view said influenza activity is increasing in most of the country. And the majority of the viruses detected are influenza A, and that's the H3N2. So we still are in the flu season, and we still are watching, how that is going to go. We still could have an uptick. So just keep in mind, wash your hands, wear your masks. So I decided I needed something that was a little bit more upbeat than COVID and influenza. So with the calendar flipping to spring and migration underway and temperatures warming, now is a great time to get outside and view wildlife. Nebraska's state park areas are an ideal place for this activity, filled with scenic trails located in natural settings. Here are the top 9 parks you should visit this spring with excellent trails for wildlife viewing. So once again, I hyperlinked the Nebraska top 9 parks with trails. So it will take you directly to the website so you can see about each one of these parks. But like we said, it's getting spring. We need to get out, get that vitamin D, soak it up. So these are the top 9 parks with trails for wildlife watching. So we need to take care of ourselves, mind, body, spirit. So this might be a way that can help us do that. This is Region 7 DHRE Preparedness Webinar Series. So just wanted to invite you guys to register and watch this preparedness webinar series. So their description for this is on December 30th, 2021, healthcare workers at 2 hospitals in Colorado were managing a pandemic and planning for a winter storm. The hospital, which includes a large neonatal intensive care unit, was full with less than 5% capacity. Unbeknownst to the staff working during the holiday weekend, the Marshall Fire was approaching the building and would cause some of them to lose their homes while forcing the hospital to evacuate in under 2 hours. Join our speakers as they discuss their experience, challenges, and lessons learned. So this is a preparedness webinar, and I think it pretty much is going to encompass, our whole pandemic and having to deal with a pandemic, plus all of the other things that are in healthcare. I think sometimes we forget that there's other things other than COVID. But while our COVID pandemic was happening, there were fires, there were, other emergencies. So I think this preparedness webinar will be something great that you guys could be a part of. All right, so Two Rivers COVID testing. So I know it says new place still, but we're still at our office. We are still providing COVID testing on Mondays and Wednesdays. We are, however, reducing that now to 9:30 to 10:30 on Mondays and Wednesdays. The amount of people that are signing up to be tested has reduced greatly. So with that reduction, you know, we're reducing hours. So still Mondays and Wednesdays, 9:30 to 10:30. But also be on the lookout that if we keep reducing, which is what we want, we will probably continue to reduce our hours. On the road again. So our mobile vaccine clinics I didn't change that to April. I'm sorry, guys. But it's for April. So April 4th, on Monday, we are doing a VFC clinic I tell you what, guys, I failed here. We're doing it from 9 a.m. to 5 p.m. Sorry about that. I'll fix that too. And then on April 6th, we were supposed to have the COSAG clinic, but we are going to be rescheduling the COSAG clinic this month due to staff trainings. So we will update everybody when we get a new date for that. And then on April 7th, which is Thursday, we are in Lexington at El Tropico from 4 p.m. to 6 p.m. And last but not least is my final slide. And this is just an announcement. You know, it is Public Health Week next week, which is April 4th to the 10th. So we will be celebrating at our office. And I just love this last picture. It is of I don't know, probably a 1940s public health nurse going out and seeing patients at their homes. So it's just a good reminder that, you know, public health has been here for a long time, and it is pivotal in our healthcare systems. So we will be celebrating this next week, and we hope you guys celebrate too. So yeah, I apparently am not as chatty as I normally am. We do have a question from Sue Peterson. She is asking, how do you feel about clinics continuing or discontinuing mask requirements in the clinics? Susan, I don't know. Katie, are you still on? You want to take this one?
I am still on. Sorry, we were talking about our Board of Health meeting.
Susan Peterson asked about how we feel about clinics continuing or discontinuing mask requirements in clinics.
You know, Susan, I apologize. This is going to be the most political answer you've heard all week. But it boils down to, we have to defer to those experts that are above us. We would prefer that most people do continue to wear masks in clinics, since you're gathering a bunch of sick people. But I do know many clinics have policies in place for like the well child checks or physical checks, and they actually schedule those in different time periods. So we'll defer to whatever those experts are at the high levels, but as much as we can prevent spread and allow people to wear masks in clinics, the more we would recommend it. Is that good enough? Okay. You can call me and we can talk to you later, Sue.
Thank you, Katie. I knew you'd give the best response. All right. Do we have any other questions? All right. Well, I'm not hearing anything, not seeing anything. So you guys always know how to get a hold of us. Email, phone, come and talk to us. we're here for you guys for whatever you need. So hope you guys all have a great weekend, and we will talk with you guys next week. Thanks.